With that, I will turn it over to Duane to talk about the future and the next steps.
Thank you, Lois. Our options, as you have heard, are this year's budget, and that will be done by June 15th. We will know what we get into the budget, and then we'll try to sell the governor on keeping it in the budget once it is passed by the legislature. The 1115 waiver is in brackets because it's not going to be pursued as Ann described. The 2016-17 state budget is our next budget option, and we'll be doing that 1 year from now. And of course, we have November 8th of next year, and there are various options available. Tobacco tax has been filed. We have our own ballot initiative to protect a fee, tax, or assessment program permanently for hospitals, and there could well be others. And then other legislative and other options are being explored. We should have those available for review this fall to see if some of those are worthy of pursuit. Our goals, first and foremost, increasing Medi-Cal payments, starting with hospital distinct part facilities, and that means eliminating the clawback to the distinct part nursing facilities between the years 2011 and 2013. Secondly, increasing payments to primary care physicians under Medi-Cal, and thirdly, increased DRG payments under Medi-Cal. Of course, implementing the hospital fee. We are now in cycle 5, and we'll have 6 cycles before the end of this calendar year. The deadlines that we're facing, it is clear that we're not going to achieve full funding by the end of 2016. And what does that mean? We are not 100% sure at this point. By the fall, we should have a handle on exactly what we're going to do in terms of strategy over a longer period of time. From the UHW standpoint, they have organizing goals, and there are certain deadlines. The big one being at the end of 2016, which is the trigger for them to have access in 2017. Since we're not going to meet the goal in 2016, then what does that mean? What are the alternatives and the consequences? This will be debated these questions will be debated during the summer months, and there'll be a major conversation at the CHA board meeting on this topic on July the 9th and the 10th. Next steps. Tomorrow, a rally here in Sacramento sponsored by We Care for California, the coalition of all Medi-Cal providers. While it is an all-day event, the primary program with legislators and others speaking will be at 12:45 and conclude by 1:45. The purpose is to educate the media and get them more engaged, educate the public, and of course provide information as well as pressure on the legislature and the executive branches. We will be evaluating the alternatives I described earlier, and you will see more about that in the fall. Commitments. Several questions have been posed to the CHA board, and on July the 9th, the CHA board will look at these issues and determine what are the commitments of hospitals, how far can we go, what changes should be made, if any, and then, because UHW has threatened to introduce initiatives for 2016 by filing them in 2015 with the Attorney General for title and summary. We're going through that debate as well, and then what does that translate into if they would happen to file initiatives? Probably means it would blow up the entire agreement. Hospital commitments on January 1. I mentioned the deadline of December 31, 2016, when we have to have the full funding, but there is a requirement in the Code of Conduct that by January 1, 2016, the 30,000 people by units will be identified, not their names, but by units will be identified, so that if we meet the goal in 2016, they would have access to talk to those people in 2017. Realizing we're not going to meet the goal, then what will be hospitals' commitments and what adjustments will we make there? 2016 and beyond, already we don't know some of the things that are going to happen between now and the end of this year, let alone in 2016. and beyond 2016, it even becomes more cloudy. However, we will be working diligently on long-term plans in an effort to find out what we can do, what's possible, and with our other partners, the We Care for California Coalition, the legislature, and others, to determine what courses of action can be taken to get Medi-Cal up to the point that it needs to be with respect to payments. With that, I would like to ask Mary Barker to cover instructions on either sending your questions online or by telephone.
Thank you, Duane. If you'd like to ask a question or offer a comment online, you can do that anonymously, and you can just type your remarks into the Q&A box that's showing on your screen and hit enter. Or you can give us a call. Just hit *1 on your touch-tone phone, and you'll be entered into the queue. And if you decide to remove your question from the queue, you hit *2. And with that, we welcome your comments and your questions.
First question just came in, and it is, do we know whether SEIU will file initiatives in September? The answer is we don't know. It's certainly possible. They're not satisfied with the progress being made under the Code of Conduct currently, and because they have threatened to introduce initiatives, what would they be on? We don't know that either, but it is likely it's the executive compensation, charity care, community benefit would be at the top of their list. There may be something on charges. However, after the last experience they had a year ago, all the other unions came out opposed to their pricing initiative because it would have hurt every employee in hospitals, and so they likely would not do the same thing again and repeat that mistake. Okay, a new question. Who will decide which hospitals will offer up contingent employee units or groups? This fall, assuming that we are still moving forward and initiatives were not filed and we're still working together for reaching the goals, we will request hospitals to identify units that consist of non-unionized employees that in the event we achieve the goal in 2016, they would be made available in 2017. We don't know which hospitals today because we haven't asked, but by October, assuming that everything is still moving forward, that question will be posed to the membership, and we will see what the response is at that time. The next question. How would you deal with religious institutions that are opposed to unionization? Several religious organizations have a strong policy, long-standing policy, that employees and management should have a direct relationship, and they are opposed to unionization. Those institutions have made it clear to us from day one that they will not acquiesce to unionization of their institutions in any form, and we respect that. The CHA policy, that's long-standing, at least 18 or 19 years, and when it was adopted, is that CHA believes that the interests of patients are best served when there is direct communication and relationship between employees and management. However, in the event that the employees select a third party in a legal election, it's up to the hospital to then comply with the law and bargain in good faith. So we believe that every hospital has the right to exercise its position, and we will support every hospital's right to exercise its own position in that regard. A new question. Doesn't Senator Steinberg's new legislation prohibit SEIU from threatening hospitals with ballot initiative in exchange for union members? That's an interesting question. I don't think that the legislation per se includes a new prohibition that didn't already exist in law. The language would imply that quid pro quo is not valid in California. However, the law has prohibited quid pro quo in California for decades. And then the question arises, is the union guilty of the law by leveraging and trying to get people to sign up as they did with us? Lawsuits are pending currently to test that question. Did UHW violate the RICO statutes by essentially leveraging us into the agreement? We'll see. Senator Steinberg's legislation does allow for several things: a longer period to qualify initiatives, legislative oversight and injection into it, and finally, the ability to withdraw or amend ballot initiatives, which did not exist prior to January 1, 2015. Another question: what's the difference between the two groups, Caring for California and We Care for California? First of all, Caring for California is the membership group of UHW and CHA. It is the Labor Management Committee. We Care for California is a broad-based coalition that's been around for 8 years. We've been a member since it started, and that coalition of Medi-Cal providers exists solely to increase and improve Medi-Cal. So they are two separate organizations. Next question: what level of participation is CHA recommending for the rally? We're leaving it up to every hospital. We've encouraged hospitals to participate and attend. There will be a place on the program where I will speak. Also, legislators, CMA, a couple of other provider groups, and UHW. The level of participation by hospitals and hospital employees we expect to equal about 5,000 in total. We expect the overwhelming majority of those to be UHW members, but a number of hospital people are planning to attend. And of course, it's easier for the people that work in hospitals in the Sacramento area to come over and spend an hour and a half or so and not totally interrupt their workday. If they're coming from Southern California, then it's an all-day commitment. But we encourage participation. Okay, here's another question. Is SEIU now unionizing employees per the agreement? In other words, the code of conduct. And if so, where? Under the code of conduct, that is, hospitals assigned the code of conduct, UHW conducted an organizing campaign at Verdugo Hills in LA, and they had a majority of the votes. However, the hospital has appealed to the National Labor Relations Board with charges of unfair labor practices. The second election that was actually held was at Mission Hospital in Mission Viejo, and there were two separate elections at the same time. The first one was for the technicals and service employees, UHW only, and the hospital won and the union lost. The second election was a choice between no union, SEIU-UHW, and thirdly, CNA. And in that case, there were more no votes for no union than for either SEIU-UHW or CHA, or UNAC or CNA. The numbers were something like this. CNA got 35 votes. SEIU-UHW received about 140 or something like that, and the no votes were 160 or 65, in that ballpark. So, in essence, they lost all three. Now, CNA has filed some unfair labor practices, and we'll see how that goes. Normally, before the board, when an appeal gets to the NLRB, it takes anywhere between 6 months and 3 years for them to resolve those questions. Another question. Can we defeat pricing, charity care, or executive comp initiatives if they are filed? The answer is, we don't know. The jury will be out and come in at the end of the day on November 8th, 2016. We will be engaged in a nuclear war, and we will be prepared, and we will go all out to defeat those initiatives. The one downside for us is that we have our own initiative on the ballot to protect permanently hospitals under a fee tax assessment program, and if we're having to, support that one, which we are and committed to do it, then we have to come in and run campaigns to defeat these others. It puts a real burden on hospitals and on all of us, because it is now a very complicated, complex, and rather oppressive election. Any other questions? Hearing none or seeing no online questions come up, we will have regular discussions with hospitals to keep you up to date on what's happening. Critical points. July 9th and 10th when the CHA board meets, and then September, and then again December 31st. And we will have calls scheduled during those times so that we can keep you apprised. In the meantime, if you have any questions, comments, suggestions, please contact either me, Lois Suter, our COO, Ann McLeod, or Gail Blanchard-Sager. Any one of the four of us will be able to respond to your questions. Of course, you can always contact the CEO of your regional hospital association, and we're in touch with them multiple times during the week, and we will be happy to get back to you. But we look forward to receiving your comments. Please do not hesitate to let us know if you have thoughts, recommendations, or observations that will help us as we represent hospitals during this complicated milieu of not only public policy forces, but also political and financial landmines. Thank you for participating today, and we will look forward to seeing you in the near future.